My name is Sierralupe, and I'm the clinic manager for Occupy Medical. We are going on 6 years that we've been offering free health care to the good people of Lane County. Once a week, we show up and we gather our doctors and nurses and herbalists and behavioralists together and just give a what we call a demo clinic to show that healthcare really is a human right. You have to show people. You can't just tell them, you got to show them. And in the time that we have been doing this, we went from just having a little tent just over at the federal building and then moving over here. People would drive by and they would wave one finger, and I'm not going to show you which one, you'll have to guess. They would advise to my doctors and nurses that they get a job. I'm not sure how to add another job onto the full-time plus job that they already had. And now those same people that were pulling by and giving us abuse, they pull over and they give us donations. They thank us for treating their family members. They thank us for treating their friends and their neighbors. They shouldn't have to do that because health care should just be available. Our bodies don't work without care. Our society doesn't work without healthy bodies. And there's a lot of people, when the Eugene Weekly came to me and says, can you tell me some people that have lost just about everything because they couldn't get access to health care? I have a hard time getting a hold of those people for two reasons. Number one, many of them are unhoused. And unhoused people, they got to be on the street and moving all the time, and it's hard to get back to them. I have people that have come in and said, I got hit by a car this winter. This is a person actually telling me that. They couldn't go to the hospitals because the hospitals were full of people that had the flu. They weren't getting their flu shots. So they had to be transported to Salem to get taken care of there. That's an extra $7,000 that Trillium did not cover. So this woman couldn't work and is now unhoused. That's wrong. That's torture. And now this society is really good about telling people that are suffering on the streets that they should just pull themselves up by their bootstraps. They're condemning them for getting hurt. They're condemning them for going to the hospital. They're condemning them for not being able to pay artificial bills that Trillium decided wasn't valuable. That's criminal. Here's another reason why I have a hard time getting a hold of people. People have their health conditions, they lose their housing, they lose their jobs, and they're ashamed. They're ashamed. So they don't want to talk to the press. They don't want to share their stories because they're full of shame that they didn't do the right thing to get themselves healthy. Where's the access to that right thing? How much money do you have to get the right thing, to get access to the right thing? That's what we have? People ashamed that they're sick? People ashamed that they can't pay their medical bills? I pay my taxes. You pay your taxes. It needs to go to make society better. People are telling me that healthcare for all is going to cost money. Well, healthcare for some, for the 1%, costs us a ton of money, and I'm tired of paying for it. Doctors that went to school, doctors and nurses that went to school and have huge education debts didn't do that so they can treat the 1%. They did that so they can treat patients, people that were sick. We are commanded to heal the sick. And some insurance company does not have the right to tell me who deserves care because everybody deserves care. It's time we have health care for all. And people with a big bank account, they are the last people that know. It's the patient, it's the doctor, it's the nurse. It's that conversation. That's where it needs to happen. Not up in some stinking office with a bunch of money flowing in front of their face so they don't see. It's not okay. It's not okay. We need a healing environment. We are the wealthiest country in the world. Well, except for a couple places that have a lot more oil than we have. But we have resources. We have plenty. We have plenty of resources. To hoard those for the chosen few, some people need more resources than others. But guess what? They're not wealthy. They're poor. Let's stop that suffering. Healthcare for all, and healthcare for all now.